Assalamualaikum warahmatullahi wabarakatuh. Hello guys, how was your day? I hope you are good. Thank you to come to this video. Me and my friends, we are going to tell you about asking, reporting, health problem, and diagnosing. Here we are going to talk about the vocabulary and useful expressions. But first, let me introduce myself. My name is Chita dari Mustikasari, and my friends.
Hi.
Hello.
We are from Group 4. We are on our second year in Nursing Study Program Cirebon in Poltekkes, Tasikmalaya. Are you ready to learn about asking, reporting health problem, and diagnosing? Okay, without any further ado, let's get to the video. Before we explain further, do you know what expressions are used by nurse when asking and reporting about diagnosis or about patient health? If you don't know, that's why you have to watch this video carefully and watch it until it's finished.
Hello everyone. Now I will explain about vocabularies which often used when we ask and report health problem, also when we make a diagnosis. The first word is break. In bahasa Indonesia it means patah. So when there's sentence like his leg is break, it means kakinya patah. The second word is bowel movement. In bahasa Indonesia, it means buang air besar. When there's sentence like the patient bowel movement 5 times a day, it means pasien buang air besar 5 kali sehari. And the third word is waterworks. In bahasa Indonesia, buang air kecil. When there's sentence like the patient waterworks frequently at night, it means pasien sering buang air kecil pada malam hari. The fourth word is constipation. In bahasa Indonesia, it means sembelit. When there's sentence like I have constipation, it means saya mengalami sembelit. The fifth word is lassitude. In bahasa Indonesia, it means lemas atau lesu. When there's sentence like he looks very lassitude, it means dia terlihat sangat lemas. And the last is in a bad shape. In bahasa Indonesia, it means kondisinya tidak sehat. When there is sentence like I feel in a bad shape, saya merasa kondisi saya tidak sehat. That's the vocabularies which often appears when nurse asks and report health problem and make a diagnosing.
The next is about nurse questions to check the patient's complaint or condition. When we're about to check patient's condition, there are some questions that we use. Okay, the first one is, what's the problem? The second is, how are you feeling today? The third is, what makes you call me? The fourth is, what's your chief complaint? The fifth is, what's troubling you? The sixth is, what's the matter with you? The seventh is, what's wrong with you? The eighth is, what seems to be bothering you? The last question is often asked by the doctor, that is, what are the symptoms or what is he complaining about?
Hello everyone. After asking the patient condition, of course, later on we will face some possible answer from those patients. They might hear from them this expression. First, they might say, I have a certain part of the body followed by ache. For example, the first is, I have a toothache. The next is, I have a headache. The next is, I have a stomachache. The next is, I have a backache. The second is, I have a short certain part of the body. For example, the first is, I have a sore throat. The next is, I have a sore foot. The next is, I have a sore arm. The next is, I have a sore knee. The third is, I have organ, followed by kinds of physical problems. For example, the first is, I have the measles. The next is, I have the flu. The next is, I have a cold. The next is, I have a bloody vomit and stool. The next is, I have a bowel movement. The next is, I have a bad cough. The next is, I have a fever. The fourth is, I feel, followed by kinds of physical problems. For example, the first is, I feel dizzy. The next is, I feel sick. The next is, I feel fever. The next is, I feel cold and clammy. The next is, I feel unwell. The next is, I feel in bad shape. The fifth is, I experience, followed by kinds of symptoms and physical problems. For example, the first is, I experience lash tooth. The next is, I experience low back pain. The next is, I experience difficulty breathing. The next is, I experience cold and clammy. The sixth is, I suffer from, followed by kinds of certain illness. For example, the first is, I suffer from cancer. The next is, I suffer from constipation. The seventh is, I sprained my, followed by chain of bones problems. For example, the first is, I sprained my ankle. The next is, I sprained my collarbone. The next is, I sprained my leg. The next is, I sprained my arm. The eighth is, I cut, followed by my certain part of the body. For example, the first is, I cut my head. The next is, I cut my leg. The next is, I cut my hand.
The last material we will discuss is nurse report and diagnosing. Is it about the way nurse report patient condition and complaint? When we are reporting patient problem, we can use this expression. She or he complained about, followed by part of body. This expression is followed by part of body that patient have problem with. For example, she complained about her back. And then when we are diagnosing, we can use this expression. She or he may have followed by disease or health problem. This expression followed by disease or health problem the patient is experiencing. For example, she may have ulcer or he may have cancer. Good morning, Miss Intan.
Morning, nurse.
I'm Nurse Ima, who is on duty this morning. Miss Intan, how are you feeling today?
I feel weak and my stomach hurt, nurse. I have defecated many times.
How many times have you defecated?
Today I defecated 5 times, nurse.
How is the consistency of the stool? Is it solid, mushy, or liquid?
Liquid, nurse.
And then, did you have bloody stool?
Not, nurse.
How many times a day did you eat and drink?
I just ate one small portion and I drank 2 glasses, nurse.
Oh, okay. Now, I will check your vital sign first.
Sure, nurse.
Okay, miss. First, I will check your blood pressure. Would you mind giving me your right hand and roll your sleeve, please? Okay, thank you. I'm going to put this cuff around in after your arm. Next, I will check your temperature. Excuse this temperature pressed in your armpit. Do you want to do it yourself?
Yes, I can do that.
And the last, I'm going to check your oxygen saturation. Would you put out your finger for me?
Sure.
Okay, Miss Intan, temperature check is done. And now, I will take the temperature. Excuse me. And oxygen saturation check is done. I will take this. Well, miss, I have checked your vital sign. For the result of your vital sign are your blood pressure is 110/70, your temperature is 38 degrees Celsius, and your oxygen saturation is 93%. Is there anything you want to ask first?
Nothing else.
Alright, miss. The assessment has been complete. For the result of the assessment, I need to consult with the doctor first to decide your future treatment. Is there anything you want to ask first?
Nothing else.
Oh, okay. Excuse me, miss.
Okay, thank you, nurse.
You're welcome. Good afternoon, Doc.
Afternoon, nurse.
Doc, I would like to report the result of the assessment regarding the patient condition, Miss Intan, from ward number 1 to 7.
What's the complaint?
The patient complained of abdominal pain, is defecated 5 times a day, stool is not accompanied with blood, consistency of liquid stool, decreased appetite. Today, she's drank to the breast, sunken eyes. The patient condition looks weak, pale, and for the result of the vital sign, blood pressure is 110/70, temperature is 38 degrees Celsius, and oxygen saturation is 93%.
Is there any other symptom?
No, that's all. I diagnosed the patient as deficiency in fluid and electrolyte.
Oh yeah. Based on the assessment data that the nurse provide, the patient should be given intravenous fluid directly.
Okay, Doc. I will do it. Excuse me, Doc.
Okay.
Okay everyone, this is the end of this video. Now you know about asking, reporting health problem and diagnosing, right? That's all we can give to you. Hopefully this video can be useful for us. We apologize if there is some mistake we made in this video. Thanks for your attention and watch this video. See you next time.